Mr. President, there was an interesting letter to the editor in the New York Times over the weekend, and it was sent by two Minnesota state representatives, and I apologize for not having their names immediately at my fingertips, but I'm going to include them in the record when we have a chance to insert them here. But a Democrat and Republican Minnesota state representative wrote a letter to the editor. It was in response to an article written by David Brooks. And Brooks, whom I respect very much, is a conservative but a very thoughtful man that I read with a lot of interest. And Brooks had written about what to do with the state and federal challenges when it came to budget deficits. And what these two Minnesota state representatives said, Democrat and a Republican, is that we acknowledge in our state and nation what we face. We face a situation where we have a weak economy, and we face a situation where the debts that are being incurred by our levels of government are going up too fast. And so having acknowledged that, we've got to find a solution. And I'm going to probably not say this as accurately, but I thought they said it so well. They said, we've come to the conclusion that we just can't cut our way out of the problem, and we can't tax our way out of the problem. We've got to think our way out of the problem. We can't lurch from one budget battle to another budget battle without looking at the fact that our challenge is a structural, long-term challenge. It doesn't relate to the immediate budget, but to a lot of things that are happening over a long period of time. And I reflected on that for a minute, and I thought, I think there's real wisdom in what they say. Because if you look at what we face at the federal level, there are reasons why we're running into these budget problems, not the least of which, as Senator McConnell mentioned earlier, is the fact that the population of America is changing. Baby boomers are going to reach a point where they'll be drawing on government benefits they've paid for over a lifetime. And as more and more of them draw on these benefits, there's an obvious question as to whether the reserves are there to take care of them. So how do we deal with that? Now, let me speak to two particular issues that Senator McConnell raised. The first is Social Security. Social Security. Is there a program that is more important to America? I can't think of one. That is the starting point of the New Deal. When President Roosevelt said, we have got to give seniors in America some peace of mind that when retirement rolls around and their senior years roll around, that they will in fact have enough money to live on. Not in a luxurious way, but the basics. There was a time I can remember in my family and in many American families where grandparents moved back in with the kids because there was no place to go. They could no longer work and they could no longer afford their homes, and they became part of the larger family. It happened in my family, it happened in others. Then came Social Security, and with a little planning and a little saving and Social Security checks, senior citizens had independence. It was a critically important thing. It was an insurance plan, not a welfare plan, an insurance plan that virtually every American paid into and every American drew from. And so where are we today? I arrived in Congress in 1983, brand new member of the House from Illinois, and they said, welcome to Washington, Social Security's broke. I said, great. I thought I'd get a little breathing space here, but in fact, there was none. And so President Ronald Reagan and House Speaker Tip O'Neill, a political odd couple if you've ever seen one, got together and hammered out an agreement. The agreement that we reached and voted for in 1983 resulted in Social Security remaining solvent from then until 2037. We wanted to buy 75 years of solvency, but we bought over 50. So those who say today that Social Security is in trouble, I would remind them, untouched, with no action by Congress, Social Security will make every payment it has promised to every Social Security recipient with a cost of living adjustment every month of every year until 2037. There aren't many things you can say that about in Washington. That for over 25 years, this program is financially sound. But the bad news is, in 2037, things change dramatically. Untouched at that point, Social Security benefits will go down 22%. Now that's a heavy hit on lower income retirees and middle income retirees. And so we know that looming 25 years over the horizon is a terrific challenge. President Obama created a deficit commission. Senator Harry Reid was kind enough, I guess kind is a word, was nice enough to appoint me to this commission, and I spent 10 months listening and then voted for the final commission product. it went into Social Security. And it suggested some things that are inherently controversial. For example, if you're going to give Social Security a longer life, what's the mix? What will you cut in benefits? How much will you increase revenue? Those are the two things. I've said Social Security is basic arithmetic. Medicare is advanced calculus. But Social Security is basic arithmetic. Although those basic decisions really get to the heart of when you retire, how much you receive when you retire, and how much you pay in your payroll deductions each month. And so the commission reached an agreement, and there were parts of it I didn't like, but it did buy 75 years of solvency for Social Security. It is interesting that we brought it up then as part of the deficit commission because literally Social Security does not add to the deficit. Currently there's a surplus in the Social Security Trust Fund, and that trust fund is being invested in government securities and being paid interest, but it does not add to the deficit. And so many of my colleagues have argued, why are we debating Social Security as part of deficit reduction if it doesn't have a direct connection? And that's a legitimate point. I've raised the same point myself. I think we should look at it. We should do it in a separate and parallel track to deficit reduction. And I welcome what Senator McConnell said. Let's have that conversation. But I don't think that it needs to be the necessary starting point for deficit reduction because there is no connection between the two. Then I heard Senator McConnell say that the president has not shown leadership on Medicare. I respectfully disagree with Senator McConnell. The whole debate about health care reform was lowering the cost of health care. You cannot balance the budget of America with 13 million people unemployed and without addressing the skyrocketing costs of health care. And so President Obama worked with Congress, House and the Senate, to reduce the growth in the cost of health care. One area was in Medicare. And time and again, the senator from Kentucky and his colleagues came to the floor and gave critical speeches saying, quote, the Obama plan is going to take $500 billion out of Medicare. Day after day after day, $500 billion out of Medicare. Well, if we are seriously talking about budget deficit reform, if we're talking about Medicare reform, we are talking about reducing the anticipated expense of Medicare and reducing at least $500 billion in cost. What will that mean to the Medicare recipients across America? Does it mean less coverage, less care? It doesn't have to. I always use as an illustration the average cost per Medicare beneficiary. In my hometown of Springfield, Illinois, the average annual cost is between $7,000 and $8,000, okay? You go up to Chicago, more specialty hospitals, a little higher cost of living. It's not $7,000 to $8,000, it's $8,000 to $10,000 a year for the average Medicare beneficiary. But then you go down to Miami, and the number is $14,000 to $15,000 a year. Why the dramatic difference between Chicago and Miami? That's a question we ought to ask. Is there better care in Florida or just more expensive care? Can we bring the cost of that care down and not compromise the quality of the care? Hard questions, but the only questions that count if you want to have reform in Medicare that doesn't sacrifice the basic benefits. What I would say to Senator McConnell is this. Yesterday, he quoted me, I guess, early in his statement. I wasn't on the floor. Yesterday, I said that I was supporting not the House Republican budget, but the budget proposed by Senator Inouye. This budget, for the remainder of this year, the next 6.5 months, would cut about $10 billion more out of spending. We would have cut $51 billion below what President Obama had asked for this year. So in the Senate, we will have reached 51. In the House, they went $100 billion below what the president asked. I think there is a qualitative, not just quantitative, but qualitative difference in the approach. I think the House Republican budget went too far. I just don't believe that we need to cut the basics in education for the lower income families across America, and that's exactly what the House Republican budget does. Let me give you an illustration. They reduced dramatically the amount of money that's going to be spent on Head Start. I don't know how many members have had a chance to visit Head Start programs. I did a couple weeks ago in Chicago. These are kids from the lowest income families in Chicago. These are kids who are most likely to drop out without some intervention, most likely to struggle in pre-K and kindergarten, and most likely to have a difficult time learning. So they bring them into Head Start at an early age, and they learn. And the one that I visited in Chicago, it was nothing short of amazing. They were teaching these little kids, and they were so impressive, Chinese as well as a Nigerian dialect, and these kids were just chattering away. And I thought, this experience, being together, learning, singing, being so happy about it, cannot help but prepare these kids for a classroom setting where they're going to learn in just a couple years. The House Republican budget dramatically cuts the Head Start programs. These kids and the teachers and staff that support them will be gone under their proposal. And what will happen to those kids? I'm not sure. I don't know if there'll be a babysitter down the street or whether someone else will intervene, but it's possible. Without early intervention and early training and education, these kids are going to show up in a year or two for pre-kindergarten and kindergarten and really not be as far along as they should be. Does that make their chances at success better? No, of course not. We know that. The studies have shown it. The second area that the House Republican budget cuts, is the money to school districts in the poor parts of America. Now, in my home state, there are plenty of those. My hometown of East St. Louis, Illinois, for example. To cut back on federal assistance to that poor community at this moment in time, I think would really be a mistake. We need to make sure that these young people have good teachers and good resources and can learn even though they live in a town that is economically poor. The House Republican budget cuts that money and cuts the teachers for these school districts. And then it cuts the money for Pell Grants. Pell Grants are the college aid grants given to students from lower income families. Many of them don't have a chance to go to school unless they get a grant so that they can proceed with their education. The House Republican budget cuts $850 a year out of the Pell Grants for lower income students from lower income families. That, unfortunately, will mean that many of them will drop out. When I went to visit with the president of Augustana College, a private Lutheran college in the Quad Cities area, he anticipated they would lose 1 out of every 20 students because of this cut in Pell Grants. So if students, when we have high unemployment, in a recession, are dropping out of college because of House Republican budget cuts, obvious question, does that make America's workforce any better? Are we in a better position to compete with China and the other countries in the world? Or will we sacrifice our advantage because students have to drop out of school? I think the answer is obvious. And that's why the House Republican budget, which some support, I think goes too far. It cuts too much in education. It would cut dramatically in medical research. What were they thinking in the House of Representatives? That we would cut the National Institutes of Health medical research in critical areas, Alzheimer's, Lou Gehrig's disease, diabetes, cancer, at a time when we know that research and innovation are critical for America's success. Why would the House Republican budget cut back so dramatically in areas that we know pay off? I think they made some poor choices, and that's why I support the Senate Democratic approach. $10 billion in cuts, but preserving in education, worker training, education research, innovation, and infrastructure the investments we need at this moment in our history with the recession that we face and 13 million Americans out of work. That, to me, is why the difference is so stark in contrast. Senator McConnell spoke with the president and said that he needed to show more leadership. I know where the president is on this. He wants us to reach an agreement in terms of the decisions which we need to make to move us toward a balanced budget. But we need to do it in a thoughtful way. First, coming out of this recession, making America's workforce stronger for the future, helping small businesses create jobs, and investing in infrastructure which creates good-paying jobs right here in America.